Hi Mama, I'm Katie. Welcome to today's update video. I'm in the 32nd week now of pregnancy. The baby's growing nicely and developing well. Let's talk about what is actually happening to baby inside the uterus, what developmental changes are happening, as well as what is happening to us mamas, to our bodies. And let's see if there are any tips that can help with the changes that are happening. So I recently went for a checkup, the 32-week checkup. The last time I was having a checkup was in week 25. So it has been quite a while since the last checkup. And I'm happy to report that everything is going well with baby, and it's a completely average baby boy. So an average baby is the following. They are around 42 to 43 centimeters long at this moment in time in week 32, and mine was estimated to be 42 centimeters long, and they weigh between 1.8 and 2 kilograms, and mine weighed 1,940 grams, so a complete average. If we were to compare it to a fruit or a vegetable, our babies are the size of a cantaloupe melon, just like this one. And I can also confirm that it feels like I have a melon inside my belly. So, what is happening to these baby melons inside us? They are becoming plumper, so they're not growing as fast in length right now, but they are gaining more and more fat. These fat layers are building under the skin, and this is what will keep the baby warm when they come into this world. So our babies in these last weeks of pregnancy are going to be gaining around about 200 grams per week. And this is more or less indeed fat, 200 grams of fat. Otherwise, their skin is becoming less and less translucent, and it is becoming pinker. So they're becoming pinker and plumper. You might be able to see the hair on an ultrasound if you go now for an ultrasound. This is what I indeed saw, little bits of hair on the head of my baby boy. So they are growing the hair. They have fully grown their fingernails and their toenails, and I also saw that on the ultrasound. So it's fascinating to see all these tiny little details. When it comes to their senses, their 5 senses keep developing, their brain keeps developing super rapidly, and those grooves and folds are developing in their brain. So they have the sense of smell, which is least developed, but the sense of taste. So they're swallowing the amniotic fluid inside your belly and tasting everything that you're eating. They can open their eyes now, and that's another thing I saw on the ultrasound. Suddenly baby had their eyes open for a few seconds and then close them again, as if he was to say, yep, I'm here and I'm alert and I'm watching you. They also can feel. Obviously they have the sense of touch, and they've been touching everything inside us, so grabbing onto their umbilical cord, potentially sucking their thumb, touching the amniotic fluid as well as the walls of the uterus and experiencing that. Baby can also hear, and they hear pretty well. They recognize your voice and other familiar sounds that they hear often. So this can be soothing for them in case you feel that they're distressed for some reason, just to talk to them calmly, and maybe that will calm them down. The lungs are still developing, but the baby is practicing breathing motions, so they're kind of breathing in the amniotic fluid to practice that that movement. And they might be getting hiccups. And that is completely normal. That's also a good sign if your baby gets hiccups. It's a part of the breathing practice. The last kind of important thing that's happening to these baby melons is that a lot of babies will now be head down. So that is the case for my baby. So the head is already here, down below. The feet are now above. So it's official. He is swimming upside down at the moment. And that is the right way to be. Not all babies will have yet flipped and are upside down, but this should be happening in the next weeks. So that was what's happening to baby melons. Let's talk about us mamas. So you might be experiencing more and increased Braxton Hicks. This is the case for me, and especially if I don't eat or drink for some time. So I try to be mindful to eat little things and drink a lot of fluids, so that so that this isn't too intense. I can feel the tensing of the muscles down here and the contraction kind of being trained. So that's the Braxton Hicks. Because the uterus is so large now, you'll be going to the toilet more often. That is my case. And you will have potentially some problems with breathing as well. And that is also my case if it's too hot, or during a workout video, or when I'm working out or going up the stairs, it is harder to breathe. And that's completely normal because of everything being squished inside there and moving around. You might also be experiencing some backaches. That's because the center of gravity is shifting, so it is important to be mindful about your posture and about movement. Don't sit in one position too long. Don't stand too long. The best way to sit would be, if you're working, would be on a pregnancy ball, just like this one here that we use sometimes for our workouts. And then you can continuously make micro movements, and that is good for you. What else? You might be getting some cramps in your legs. So magnesium is great for leg cramps, as well as stretching the calves before you go to sleep. So this I highly recommend. And yesterday I forgot my magnesium and woke up feeling a cramp creeping in, but then stretched out that calf, pulled the toes towards me, and it went away, thank goodness. But just another reason to not forget to take the magnesium regularly. And another thing that might be happening is you might be experiencing swelling in your hands as well as in your legs. So for that, you can put your legs up so all the fluid kind of comes down and you give your legs a break. But also compression stockings are fantastic. I am wearing compression stockings right now as we speak. They're extremely hard to put on and take off, but thank goodness once they're on for the day, and you know, I have to worry only at the end of the day to take them off again. But they make a massive difference, massive, and I can feel it in the shoes that I wear. If I put the stockings on, the foot goes in easily. If I don't have the stockings on, I feel a lot less space in the shoes. So highly recommended. One last thing that I wanted to mention in today's video is that babies that are born at 32 weeks, they're considered moderately premature, and with the help of specialized doctors and in the neonatal intensive care unit, they will survive. They just need to stay there most probably for some days, potentially weeks, to still put on a bit more weight and a bit more fat, and also to develop the coordination of feeding. They might need also some breathing support. So they might need a few days or weeks in this NICU unit, but if your baby is born now, then most probably they will survive and then thrive later in life. So that was it for the updates for week 32. I hope you're feeling well. I hope you're exercising. And I hope to see you in the next days and in the next workout videos. Take care, Mama. Stay strong, stay fit, physically and mentally. And let's keep going in this third trimester. All the very best. Bye.